Today at ASCO Highlights, I talked about metastatic breast cancer and what came out of ASCO 2019. There were many interesting presentations, and most notably was the updated overall survival of IMpassion 130 that looked at atezolizumab with nab-paclitaxel in triple-negative breast cancer in the first-line setting for metastatic disease. And what the overall survival shows now is a 7-month improvement from 18 to 25 months in median survival for patients who received atezolizumab with nab-paclitaxel if they were in the PD-L1 positive subgroup. So based on those data, as well as a 2.5-month improvement in progression-free survival for the PD-L1 positive group, we now believe that the standard of care for PD-L1 positive patients with triple-negative breast cancer that's metastatic should be atezolizumab and nab-paclitaxel. We also saw improved overall survival in another subgroup of breast cancer, the hormone receptor positive group, that's HER2 negative. And in that group, in the MONALEESA 7 trial for premenopausal women who were treated with endocrine therapy with or without ribociclib, the group that got ribociclib had improved overall survival as well. And so for the first time, we have a drug combination therapy in the hormone receptor positive subgroup that leads to downstream overall survival advantage. And so this is a new standard of care as well for the premenopausal women who have relapsed or recurrent disease that is hormone receptor positive and HER2 negative. We also saw in that subgroup some interesting phase 2 data looking at another class of agents, the AKT inhibitors, and in a randomized phase 2 trial showed significant progression-free survival improvement for a drug called capivasertib, which is an AKT inhibitor, and we're awaiting phase 3 data there. In the HER2 positive space, there continues to be a lot of interest in developing new drugs. We saw a phase 3 trial of a engineered antibody called margetuximab that was engineered in a way to take advantage of the immune therapy effect of anti-HER2 antibodies and did show some benefit compared to trastuzumab with chemotherapy. And so we'll look to see further data for that. And we also saw the phase 3 NALA trial, which compared neratinib, a small molecule tyrosine kinase inhibitor of HER2, with capecitabine compared to lapatinib, another tyrosine kinase inhibitor that's been around for some time with capecitabine, and showed a progression-free survival benefit for neratinib and capecitabine, which gives us another alternative in late-line HER2 positive breast cancer. Additionally, the neratinib combination showed less in the way of progression in the central nervous system, confirming some anecdotal data that we had seen from previous studies.